Hello, everyone. My name is Shaylin Schmidt, and I am a GTA for CSU's music therapy program, and I live in Colorado.
Hi, everybody. My name is Joanna Kennedy. I am a music therapist based out of Boston, Massachusetts. I work mainly with children and young adults with autism.
Awesome. So we are reviewing chapter 6 of Schwartz's book, and it's called Client Needs and Verbalization in Music Therapy. And it talks about how the client's needs are the most important in planning treatment. And also it talks about deciding when, why, and how to employ verbal skills. And words can be used in 3 ways. 1 is as an agent of change. 2 is together with music as an agent of change. And 3 in support of the music as an agent of change. And one thing to note is that the client benefit always comes before the therapist's convictions.
Yes, so in the chapter, Schwartz is talking about 4 basic categories for verbalization. Those are verbal framing, verbal exchanges, verbal interactions, and verbal interventions. So all 4 are useful, but it's dependent completely on the individual circumstances. So I'm going to talk about the verbal framing and exchanges. So framing and exchanges are included in most music therapy sessions, and they're used to orient the client towards the music and the music therapy to inform about the experience that they will be expecting in the session. And so also the exchanges also provide assessment details for the music therapist. And so Schwartz kind of breaks this down in a summary as verbal framing directs the client into the musicking, and verbal exchanges support and guide the client into musicking or towards the verbal interactions, which Shaylin will talk about in a minute. So one example of this may be in a session where you're about to use a specific action song, where there's specific movements involved. The verbal framing would be prepping the client for what was to come next. So you might say, we're going to listen to an action song now. That would be your verbal framing. It's prepping the client for what comes next. And then you play the song, you do the intervention, and then the verbal exchange, maybe after the song, the client says, oh, wow, that was fun. That's the exchange afterwards. And so this exchange can lead into more musicking or towards verbal interaction. So in the case where you're moving towards interaction, you might say as the therapist, oh, Johnny, what was fun about it? What did you like about it? And that's moving into the verbal interaction.
So the verbal interactions are where a client might share their experience. It can lead into musicking or verbal processing. So it's a very flexible way of interacting. And so one example would be maybe in group drumming, talking about how an individual and their playing fits into the group as a whole, which could lead into more musicking or verbal intervention. Another example would be talking about what lyrics do you think should come next in your song? So that can either lead into musicking and creating those lyrics, or that can lead into the verbal intervention. And so in the last one, verbal interventions, that requires both the client and the therapist to use spoken language and verbalizations as the primary agent of change. So that would be, tell me what about this line stuck out to you? Or after lyric analysis, after listening to a song, how do you think this singer feels and why? And then kind of diving deeper into that conversation.
So Schwartz lists here in the book some bullet points for when to use the verbal interventions with a client. And so some of those are when it is not accessible to use music interventions, when the client needs and wants to verbalize insight and is ready to do so, when the client needs and wants to resolve problems through verbal as well as musical means, and when the client can achieve therapeutic growth more directly through the use of the verbal intervention versus the musical intervention. And so one example from my clinical experience is I was working with a young adult with Williams syndrome. And so at the time, she was kind of having a hard time at home, specifically with her dad. And in the middle of the session, she just started verbalizing what was going on at home. And in that moment, she was ready and able to verbally process what was happening in her life. And she wanted to go through that in our session. And so in that moment, the verbal intervention was much more beneficial because she was ready and able to do so. And it was a much more direct way to process what was happening with that client at the time.
Along with that, there are some times where words can be detrimental. And so Schwartz also listed some times where you may not want to use verbal interventions. So one would be if the client reveals details that the music therapist is not prepared to handle, and that could hurt the therapeutic relationship. So as music therapists, there's certain training that we don't have as far as how to deal with certain things that clients reveal to us. And so that might be an area where you would not want to use verbal interventions. The second would be if the client may use language to deflect from the topic at hand or relating with others. So talking about unrelated things. I recently had a client that was saying, I want to go outside throughout the whole session. And so that was obviously deflecting from the intervention itself and what we were doing. So just not verbally using an intervention in those situations. And then third would be if there's a lack of congruence between the client's words and reality. So if a client has dementia or is experiencing psychosis, they might be using superficial meanings of the words. So if you, for example, said, what's a dream that you have, that might be taken more literally. So that would be another time where you would not want to use verbal interventions.
Definitely. And so all of this kind of connects to Rosenberg's chapter number 6, which is requesting that which would enrich life. And so Shaylin and I are both going to talk about a couple of things from this chapter, but some of the ones that I kind of saw were making requests consciously, mainly because it says in the text how we are often not conscious of what we are requesting. And so that kind of ties back into what Shaylin was just talking about with when verbal interventions may not be best used in a session. For example, when a therapist isn't qualified or trained enough to deal with certain situations that might come up through verbal processing, and just really highlights the importance of word choice and language choice as a music therapist running a session.
Absolutely. So requests, those show empathy towards a person's needs as opposed to demands. And so that's really important, is basing your relationship on honesty and empathy to help with the therapeutic rapport. It's also important to use positive action language, which is also outlined in the Rosenberg chapter. So using concrete actions that someone can take and using language that's clear, positive, and concrete versus vague language. And so when you're having all this verbal dialogue and everything that we outlined in the Schwartz chapter, you'll want to make sure that you're using that positive action language with your clients. Thank you for listening to our presentation.